Hi, this is Dr. Tonya, and I am a radiation oncologist, also a breast cancer survivor. And I wanted to take a few minutes to do a video addressing the question: is radiation therapy safe? As a new cancer patient, you may have been told that radiation is part of your treatment, and you may have some concerns as to whether or not radiation is safe. Because many times we will hear stories from people about survivors who have gotten side effects or toxicity burns from radiation therapy. And that can make you really uneasy about whether or not you actually want to proceed with radiation as part of your treatment. But when we talk about what is radiation, if you watched one of my previous videos where I talked about radiation is, you realize that radiation really is just intense beams of energy that are produced by a source. They travel through space and they're used to kill cancer cells. And they are in a very effective way to kill cancer. And 2 out of every 3 people who get cancer get radiation as part of their treatment. So it's very, very common. And making radiation therapy safer is basically a 4 step process that has progressed over time. Radiation is much, much safer today than it was back in the early days of radiation, back in the 1950s. But the process that we go through to make radiation therapy safe starts with one proper positioning. And this is a treatment planning procedure that is done initially before you get your treatments. We call this procedure a simulation. It starts by putting you in a comfortable position that can be reproduced each day because it is essential that you are in the exact same position every day for your treatment in order for us to be able to target the area that needs the radiation. So once you're in a comfortable position, and make sure that position is comfortable because it is a position that you're going to need to be in every day. And sometimes you may need to lie in that position anywhere from 5 minutes to 30 minutes. So make sure it's comfortable. Take the time. If need be, have them adjust your positioning so that it's comfortable. Once that is done, then if needed, the staff may need to create what we call a mask or some type of form or mold to keep the area that's being targeted from moving, because it's again essential that the target area is in the same place every day and that it's not moving while the beam is on. So something like this, a mask, if that's the area being targeted, this mask will keep your head still. It will keep the target from moving. You may have to cough, you may have to sneeze, but with this mask on, the target area won't move. So that is the reason why they will make something to immobilize the area that's being targeted to keep it still. We don't want it moving while the beam is on. Also, during that simulation process, some marks will be put on your skin. These marks are used by the therapists who treat you every day to line you up for your treatment. It is essential that these marks stay on for the entire course of your treatment. Sometimes these marks are done with tattoos. Sometimes these marks are done with just a marker, Sharpie marker, and they put some clear tape on top of the marks. Either way is fine. Different centers do them different ways. If it's a tattoo, typically it's just a little dot, not anything large enough for anyone to know but you and the people treating you. And if it's a marker, the clear tape that is put on typically stays on really well. You'd be surprised. You can shower, change just like you normally would with the marks on your skin. But if for some reason they do start to come off because you're coming frequently for your treatments, those marks can be touched up and reapplied if necessary. Once those marks are put on your skin, then you will get a CAT scan done through the area that's being targeted. And depending on what area is being targeted, you may need to receive some contrast, either contrast that you drink or contrast that is put through your intravenous system so that we can see those target areas, those blood vessels or esophagus or colon, so we can see those areas that we need to target to help plan your treatment. So, and because of the area that's being treated, if it's in your pelvis, you may be asked to come with a bladder that is full. They may ask you to come with a bladder that is empty, or they may make you empty your rectum so that there's no stool in the rectum prior to the imaging, because again, it is imperative that the area being targeted can be reproduced and set up the same way each day for your treatment. So once the images are captured, then the treatment planning process, precise planning, starts. We call this dosimetry. So in addition to that CAT scan that was done during the planning session, you may or may not be asked to do some additional imaging with an MRI scan or a PET scan. Those scannings allow us to see the area being targeted in 3 dimensions. So we're able to not only see where the cancer is, but we're also able to see where the normal tissue is that's around the cancer. And that allows us to plan out a treatment that maximizes dose to the target area that we want to treat and minimizes the dose to the surrounding normal tissue so that we can reduce the amount of side effects that you get from treatment. Some of the beautiful advances in the technology with radiation therapy is the ability to fuse images to help us target more effectively and be more precise in our targeting. So what you're looking at now is an image fusion of a CAT scan of a breast fused to a PET scan, and you can see the brightness where the tumor in the breast lights up on the PET scan. So for certain disease sites, the PET scan allows us to see the cancer better than just a CAT scan. So then we have our dosimetrist, and you will recognize the dosimetrist from the last video when we talked about Meet the Staff. That is the person who actually plans out your treatment along with the physics staff. So they map out each treatment in detail using treatment planning software. So once the plan has been completed and you're looking at an example of a completed treatment plan for a right breast, you can see the beam angles where the beams enter and they exit the breast. You also can see how the beam actually lays on the skin, and you can see the dose distribution inside the breast. Now, once the treating doctor has approved the plan that was done, then we move on to the next part of the safety process that we call peer review. Now, peer review is an independent review of that treatment plan. Now, there is a panel of independent physicians that are not involved in your care who look at your plan. They look at your entire case. They make sure that the prescription that your doctor prescribed for you is correct in accordance to your diagnosis, the stage, and the dose. Once they approve that, then they make sure that the plan that was done by the dosimetrist who created your treatment plan was done correctly and is delivering the dose that was prescribed by your doctor while minimizing the dose to the critical structures. So once that is approved, then you will go on to treatment. Now, if for some reason this independent review finds something that they want changed, they will send your case back to your doctor or the planner to make those changes. And that may mean that your treatment start date may be delayed a few days to make those changes. So if you get a phone call about a delay in the start of your treatment, that may be why they are trying to get your treatment plan perfect for you before starting your treatment. Now, once the peer review process has been completed, we move on to the last step of the radiation process. And I call this step 4, perfect treatment delivery, because that is the goal in radiation therapy, is to deliver your treatment perfectly each day. Now, one of the ways that we're able to treat you safer with radiation is because of the serious advances in technology that we've had in radiation therapy since we started using it as a treatment modality for cancer. Radiation began with more archaic units that we call cobalt 60 units. In the 1950s, these units only had one energy, and because of that, we were not able to customize the dose as well as we are today. And because of that, when you saw lots of side effects, lots of toxicity related to the radiation treatments. But technology has advanced. We now use linear accelerators. And even since I started treating patients with radiation therapy almost 30 years ago now, the technology in the machines that we use has advanced tremendously. So the modern linear accelerators that we use now to treat you have what we call image guidance. So these are room localization and monitoring technology. So we're able to, once you are set up in the room and the therapists come outside the room to treat you, there's technology in the room to make sure that you're in the right position. And some of the technology, the beam will turn off if you move out of position, or they will make adjustments to your setup if you've lost weight, if you've gained weight. So this technology now that's on our machines allows us to not only treat you safer, but more accurately. In addition, modern linear accelerators have computer verification systems. These are computers inside the machine that make sure that all of the data that was inputted from the planning team is actually being set up correctly in the room. So they verify that you are in the right position, that the table is in the right position, that the beam angle that has been set to treat you is correct, that the dose that was put in is correct. All of those things need to match before the machine will allow the therapist to actually turn the beam on to treat you. So we have all kinds of checks and balances in place to make sure that everything is correct before the beam comes on. In addition to having all of that in place, then we have multiple checks that are done by other healthcare professionals. This includes the person that planned your treatment, the dosimetrist, the physics team. They double check everything, they double check all the calculations. Your doctor will also go over and double check everything. So there are multiple checks and balances in place to make sure that your treatment is correct. In addition to checking your plan, we also have staff that check the machine to make sure that the machine is delivering the dose that it should be delivering. All of that is checked ahead of time before you get a treatment. So you can see by following these 4 steps: proper positioning, precise planning, the peer review process, along with perfect treatment delivery, allows us to treat your cancer in a way that is safe and accurate. And by following these procedures that I just outlined in this talk, I can confidently assure you that radiation therapy is safe. So if you found value in this video, please share it, please like it. If you know someone who could use this information, please pass this information on to them. If you have topics that you would like me to cover, go ahead and drop that in the comments. I'd be happy to do a video about those for you. I'm Dr. Tonya. I am your sister in the journey. I am here to help you get through your treatment confidently and empower you with information. I will see you guys next time.